Neck retraction. When you have neck pain, it's important to do this exercise very gently at first. It's up to you whether you perform it sitting or standing. Begin by looking straight ahead. It's important that you keep this position and don't look left, right, up or down during this exercise. It may help to focus on a specific spot in front of you. Now, pull your chin backwards in a straight line. Do this very gently at first. Don't just pull your chin all the way back. This will hurt. Now relax and repeat this 10 times. You don't need to hold the position for any length of time. Aim to perform this exercise every waking hour. Many people find that gently holding their tongue in between their teeth helps during this exercise, as it tricks the muscles on the front of the neck into relaxing. Neck flexion and extension. Start with your head in the middle position. Now simply look up until you feel a stretch in your neck. Then return your head to the middle position. Now look down until you feel a stretch in your neck. You shouldn't feel any pain. Stretch until you're on the edge of pain, but don't stretch into it. Hold the stretch whilst looking up and down for between 5 and 30 seconds. The longer you hold it, the harder it will be. Relax and repeat the stretch 5 times. You can do this up to once per hour. If your symptoms get worse, then you're holding the stretches for too long or stretching too hard. If you get dizzy or lightheaded while looking up, it's important to seek medical advice and stop the exercise. Neck rotation. For this exercise, you should begin with your head in the middle position. Now simply look left or right until you feel a stretch in your neck. You should stretch to the edge of pain, but you should not feel any. Hold the stretch for 5 to 30 seconds. The longer you hold it, the harder it will be. Relax and repeat this 5 times. This exercise can be performed up to once every hour. And if your symptoms increase, then you should cut back on how hard or for how long you're holding the stretches. Neck lateral bend, ear to shoulder. Start with your head in the middle position. Move your ear to your shoulder, to the left or the right, until you feel a stretch in your neck. You should stretch to the edge of pain, but not into it. Hold the stretch for 5 to 30 seconds. Relax and repeat 5 times. You can perform this exercise up to once an hour. Be aware that if your symptoms worsen, then you're stretching too hard, and you should reduce how long you hold the stretch for. Neck strengthening. Flexion. Begin this exercise with your head in the middle position. Now place the palm of your hand on your forehead and push your head into your hand. Offer the same resistance back from your hand. There should be no movement and you shouldn't feel any pain. Hold this for 5 seconds and repeat it 5 times. You can perform this up to 5 times per day. If your symptoms worsen, then you're doing this too hard or too often. Extension. With your head in the middle position, place the palms of your hands on the back of your head. Now push your head into your hands and offer the same resistance back from your hands. There should be no movement and you shouldn't experience any pain. Hold this for 5 seconds and repeat it 5 times. You can perform this exercise up to 5 times each day. If your symptoms get worse, then cut down on how hard or how often you perform the exercise. Side flexion. Start with your head in the middle position. This time, place the palm of your hand onto one side of your head. Push into your hand with your head and offer the same resistance back from your hand. You shouldn't feel any pain and there should be no movement. Hold this for 5 seconds and repeat 5 times on both the left and right sides. You can perform this up to 5 times per day. And if your symptoms get any worse, then you're doing this too hard or too often. Rotations. Begin with your head in the middle position. You should place the palm of your hand onto one of your cheeks. Push into your hand with your head and offer the same resistance back with your hand. so that there's no movement. You shouldn't feel any pain. Hold this for 5 seconds and repeat 5 times on both the left and right sides. You can perform this up to 5 times each day. And remember to cut down on how hard or how often you do this if your symptoms get worse. Neck self-massage. Trigger point massage. For this exercise, begin by standing against a wall, with a small ball or roller behind you on the affected area. Apply enough pressure to give you relief, but not enough to cause any pain. A lot of people like the deep pain that this massage can cause, and some even do it so hard that they bruise themselves. Harder is not necessarily better. Now roll the ball or roller around on the affected area by moving your body. This should relieve the tension. You can perform the massage for up to 10 minutes and do it as many times per day as you're comfortable with. This massage is done more often in the middle to late stages of recovery.